Support for Colorado Today comes from Credit Union of Colorado. With access to over 30,000 ATMs and a mobile app, they're dedicated to offering the services of a big bank with a heart. Learn more at honestlygood.org.
Welcome back after this holiday weekend. Hope it was a good one for you. A bunch of the team here at Colorado Today had an interesting experience this weekend. We went to the Rockies game Friday night, and guess what? The Rockies won. The home team is currently on track to be the worst team in baseball history. But it was a good night at the ballpark, and we'll keep hoping for more to come. I'm Bazi Kanani.
And I'm Haley May, filling in for Arlo. Coming up, now that Republicans in Washington have passed changes to Medicaid, what'll it mean for you in Colorado?
Polis is saying that it's not as simple as saving taxpayers' money by kicking people off of Medicaid.
Then, psychedelic healing centers are about to open in Colorado. Some potential patients can't use them legally.
I can either continue to advocate and risk the consequences, or I can shut up and watch my friends die.
How military veterans are navigating treatment options for PTSD.
Plus, the rise of river surfing near downtowns.
I've looked actually all over the country for surf waves, and this is like one of the best ones.
It's Tuesday, May 27th. Here's the news in Colorado today. The numbers are in. 200,000 Coloradans could lose their health insurance under the Republican spending bill that passed the House and now goes on to the Senate. CPR's John Daly is here to explain what this means for all of us. John, one of the major changes is to require that people who get Medicaid work. So how would the rules be different?
Well, they're not ending Medicaid altogether, but they're making it harder to qualify. Right now, the federal government doesn't have a work requirement for Medicaid.
Okay, and who do the work requirements target?
Well, the work requirements target adults who don't have children or disabilities. Those folks would have to prove they worked, volunteered, or went to school for 80 hours in the month before enrollment. And there's new paperwork requirements with this as well, and that could turn out to be pretty onerous to prove that you do work and still qualify. So the fear is that people won't make it through the paperwork and will still lose coverage.
Has there been research showing who's the most likely to be unemployed on Medicaid?
Studies show it's mainly women in many cases because they're serving as caregivers for other people in their lives.
There are other new rules in this bill about what people who are still on Medicaid can get covered, right?
That's right. Among the changes, if you're on Medicaid, you wouldn't be able to get services at Planned Parenthood covered, even if that care is not related to abortions. Now, abortions are already ineligible for Medicaid funds. And unsurprisingly, given the Republican stance on transgender rights, the bill limits coverage for gender-affirming care.
Another major change in the House bill is to push more costs onto states. We know that Colorado's already facing big budget issues in the next few years.
Indeed, big budget issues, and that's why Governor Jared Polis said last week on a call with other Democratic governors,
there's not money there at the state level. They're basically asking states to do their dirty work for them and terminate people from their health care coverage if they cut federal funding.
So the governor's argument is that if that happens, people who are uninsured, they'll still go to the hospital, right? And the hospital just won't get paid for treating them. And to make up for that, Polis says, Coloradans who do have insurance will see their costs go up. So in that way, Polis is saying that it's not as simple as saving taxpayers' money by kicking people off of Medicaid.
Okay, so the bill also tries to coerce states to stop using their own funds to provide health insurance coverage for people who aren't in the country legally, and Colorado's one of them.
That's right. Colorado is among a few blue states in this situation, and Colorado does cover undocumented pregnant people and kids. That total is nearly 20,000 people, according to the Colorado Children's Campaign. So if this goes through and Colorado continues to cover these folks, Colorado would get even less Medicaid reimbursement from the federal government, so this provision forces another tough decision on states.
What else stands out to the experts that you've spoken with?
Well, there's a big concern that this bill also makes deep cuts to food aid, food stamps, right? The families of about 1 in 4 Colorado children use the program called SNAP to help afford groceries. But I've also heard some hope that this bill is not final. I talked to a rural hospital CEO, Connie Martin. She's the CEO of San Luis Valley Health, and she's concerned but told me
there's still the opportunity for the Senate to be thoughtful about this and reconciliation to be more thoughtful about it.
Okay, lots to keep an eye on. Thanks, John.
Indeed, you bet.
Colorado has started to license psilocybin healing centers. They could open any day. I've been reporting on what that means for one group that may benefit, people who struggle with PTSD, particularly military veterans. Experts have told us that currently there's not an effective cure for PTSD, and psilocybin-assisted therapy has shown promise. An estimated 7% of military vets will be diagnosed with PTSD in their lifetimes.
And you're in this constant battle, this constant struggle to maintain any sort of normalcy, as well as trying to just find any sort of peace and happiness.
I recently spoke with Matthew Butler, who was diagnosed in 2011 while he was still in the Army. He'd done 6 tours between Iraq and Afghanistan, and initially he used a mixture of antidepressants, opioids, and alcohol to quiet his demons.
You know, like you're on so many medications that require other medications to handle the second, third order effects of being on the original medications, which makes it problematic sometimes for maintaining a job and lifestyle. And then things just kind of tend to spiral out of control.
By 2018, despite various forms of treatment, including counseling sessions at the VA, he was arrested after an argument with his father turned violent.
I just kind of made the decision in jail, like when I get out, like I'm going to do whatever it takes to get a handle on this.
Butler tried psychedelics.
It really amplifies and allows our nervous system to begin to process and metabolize these traumatic experiences much more effectively than when we're in our ordinary state of consciousness.
Dr. Saj Razvi is the director of education at the Psychedelic Somatic Institute, which has a branch in Denver where they do training for psychedelic-assisted therapy. Psychedelics, according to Razvi, can help patients with PTSD form new neural pathways.
And so the more they can process through this memory in this safe container, the less it will trigger them when they're walking around in a grocery store or when they're over breakfast with their spouse.
But even for those it might help, like Butler, veterans enrolled in the VA healthcare system cannot legally get a prescription for psilocybin right now. Butler is frustrated. He says psychedelic therapy saved his life.
I always referred to antidepressants as a chemical lobotomy. Sure, they take away my pain and depression, but they take away everything else as well. I can't dip any lower, but I also can't experience any joy either. Whereas plant medicine, it accentuates your positive emotions.
He's gone on to lead psychedelic-assisted therapy for other veterans. But since psilocybin is still federally illegal, it's hard to access, and veterans who use it could face consequences tied to their VA benefits.
I'm at an ethical crossroads here, and I can either continue to advocate and risk the consequences, or I can shut up and watch my friends die.
As veterans like Butler monitor how the federal government will handle psilocybin, wait times for mental health treatment continue to rise. New mental health patients wait an average of 43 days at the Rocky Mountain Regional VA Center due to a lack of available staff. And that's without Trump's proposal to cut a fifth of the VA workforce. Psychedelic therapy certainly can't solve the staffing problem, but veterans suffering from PTSD sometimes struggle with alcohol and suicidal ideation while they wait. The lack of available doctors and treatment options for some veterans is a matter of life and death.
Now that Memorial Day weekend has passed and many schools are on break, the summer season and summer activities are here. Have you tried surfing in a river, in Colorado, in a city?
They did a really good job of making this.
Really random that Pueblo has something really cool.
Pueblo residents Brad Roberts and Nate Grigg are stoked that their city has just celebrated the official opening of a new whitewater park.
I've looked actually all over the country for surf waves, and this is like one of the best ones.
It's awesome. You feel like, honestly, you kind of hit that high where you're just floating on the water, and it just feels like you're almost floating in air. Like it just catches you at the sweet spot.
Feels like floating. KRCC reporter Shauna Lewis has seen it, and she's here to tell us more. Shauna, is it really that good?
Well, that is what experienced river surfers tell me, because I am not one. I did not put on a wetsuit and try it out myself. You know, it does look like really big fun, Bazzi. Unlike in the ocean, river surfers don't have to paddle out to catch a wave. They're already right at the wave. So they step onto their boards and they just try to stay balanced as they guide their boards back and forth along a steady stream of water that's gushing over a man-made stone feature. And when they fall, they have to swim out of the river to try again.
Yeah, that falling is what looks like the hard part.
Yeah, I think so too. But, you know, river surfing is gaining in popularity in Colorado. There are now several of these specially designed river surfing waves. But the latest, and what I'm told the greatest, is now at the new Pueblo Waterworks Park. And this park is a result of an $11 million project to transform a really dangerous part of the Arkansas River into recreation space.
What was so dangerous there?
Well, for more than a century, there had been a small dam there, and despite warning signs, people tried to raft over it, and some of them died. So a few years ago, the city's water utility decided to replace that dam with a safer series of gradual drops instead. Seth Clayton is executive director of Pueblo Water.
What we really wanted to do is make this a family-friendly environment and something people could come down, just enjoy. It's free.
Free is good. So is family friendly. Shauna, does this mean that even children can river surf?
Well, that depends on the kid, of course, but river surfing, it might be a bit much for young children, but that surf wave is just one part of this new water park. The redesign made the river floatable from near Lake Pueblo to the city's other whitewater park downstream near the historic district. And I've seen people in this new one kayaking and tubing and just really having a great time. One more thing, this new park makes it easier for fish to migrate upstream. So it's better for the environment, and it also makes it for an even better place to go fishing. All of these activities combined are already drawing lots of new visitors to town. And that's really wonderful news for business owners like Bob Walker, who owns a local outdoor shop.
It really makes me excited that the guys from Boulder, the guys from Denver, the guys from Fort Collins, Grand Junction, just everywhere are here. People are literally changing their travel plans to be here. The economic impact on Pueblo, I believe, is going to be felt.
Yeah, you know, I've been out there several days already this year, and it has been absolutely packed. So far, it's looking like a big success. And Bazzi, maybe you should come down and visit us and check it out.
I'll bring the wetsuits if you bring the boards.
Okay, it's a deal. We'll go to Bob.
See you there. Thanks, Shauna.
Thank you.
Thanks for listening to Colorado Today. When you get a moment, tell a friend what you liked about today's show. I'm Bazzi Kanani.
And I'm Haley May. This is CPR News.
Support for Colorado Today comes from Credit Union of Colorado. With access to over 30,000 ATMs and a mobile app, they're dedicated to offering the services of a big bank with a heart. Learn more at honestlygood.org.